Yeah, temporomandibular joints.
Yeah.
That's the main issue. So how long? You also need body pain?
Yeah.
Okay. Can you remove your specs for me, please? So for the temporomandibular joint, what have you done till now? Any conservative treatment apart from splints?
No, we did the mouth guard.
That's
We
it.
did some injection.
We did
Oh.
the cortisone injection
You
last.
have also the injections done.
Yeah.
Can you open? Oh, okay. Close. Okay. Open. Okay, close. It's getting dislocated every time she opens.
Right.
Open a little bit. Okay, bite. Leave it loose. You have some pain there? Even this side?
It's mostly this way.
More on this side? Right, so she has issues with the temporomandibular joint.
Yeah.
See, but at this age, I don't recommend any surgery.
Right. But I see you are doing, with the hand lifting up, putting back in there, in the
But
online.
that's for people who are not able to do it on their own.
Okay.
What's happening in her case is what we call as a self-reduction,
Okay.
meaning the joint is coming out
Okay.
and automatically going back in.
Yeah, yeah.
So she doesn't need anyone else's help.
Okay.
For some people that doesn't happen. It just comes out and stays stuck outside, and then obviously I will have, or someone else has to help that jaw to get back in. But this way of self-reduction continuously causes the pain,
Right.
because this is not supposed to be the way the joint's functioning.
Okay.
So what's basically happening is every time the joint is doing this, it's wearing the ligaments and the attachments around the joint,
Okay.
Now, I will suggest a few conservative techniques, methods that you can try and incorporate.
Okay.
It works with varied degrees of success in individuals. I cannot guarantee you that this is gonna work.
Okay.
Because if it is something like that, we will do a surgery. But I've had a lot of patients who have somehow been able to manage without a surgery. And a temporomandibular joint surgery for this is not a simple surgery.
I know.
Sometimes, even after surgery, people can persist with issues with pain especially.
Right.
So, what you can do is, she's already worn the splints and the splints have not worked. She has pain. When I palpate, she's got pain along the muscles of mastication, which means that the whole area is still
She got very stiff over here in the jaw.
exactly, very
Yeah.
stiff even now.
Right.
So we'll have to somehow give some relaxation to the joint.
Okay.
So the first main thing that you have to understand is the joint's mechanics. So the joint has two motions, okay? You listen carefully. First is a movement like a rotation, okay? And then the next one, it comes down. So when you open your mouth, open slowly, that much is okay. Because that's just like this. If you open more, it will move down and come out. So you have to consciously prevent the second movement of the joint. Thereby, you prevent the wear and tear, and you prevent the tension or the hyperactivity of the muscles. So that will give you relief. So for example, you don't yawn wide. I saw that much mouth opening is good. So try to manage eating food with little mouth opening such that the joint never comes out. Now this is opening. More than that, if you do, it will slip down and you can feel it. You shouldn't let that happen.
Okay.
That's the first most important step that you should do. By doing that over a period of few weeks or months, it will heal. Everything once it heals, in this age it will heal fast.
Right.
And then you don't need anything. That's it.
Okay.
Okay? Now I'll also tell you some other techniques that will help in the healing. For example, you can apply some Ayurvedic oil.
Okay.
I can also refer you to a brilliant Ayurvedic doctor.
Okay.
He lives in Bangalore. You
Okay.
can contact him on WhatsApp and meet him
Okay.
if you happen to go that side. But any other person in your place, basically to give some oil, what it does is increases the vascularity or increases the blood supply. When the blood supply increases, it heals faster. Simple logic.
Okay.
So it works.
Okay.
Even some Egyptian oils work. So that's the logic of the oil. Along with that, you can do what is called as hot fermentation. So you can use some, towels.
Yeah, we
Use
do, I
moist-
do icing, heart therapy, I did everything. I tried everything all over the place, the doctor too. So I
Yeah.
see you online, then I thought, I come.
But I
here to
think,
see you.
with the main thing is that she shouldn't open the mouth much.
Okay,
If she does everything that she's doing, none of the treatment's gonna work.
okay.
Because you see, every time a joint is slipping out and coming out, then what will work? Nothing will work. So that has to be prevented, and these things should be done.
Okay,
The only other option we have is surgery if you don't do this. So I think it should be tried in a much more serious manner. And I
okay.
think you should get some benefit with this. The other thing that works is trying to sleep supine, straight,
Okay.
not on the sides, because it's a jaw that's like a U shape, so you can apply
Okay.
pressure. And one more thing that helps these kind of patients is some exercise, like jogging.
Questions for you.
You follow it? So you
She's so lazy, she don't want to get out of the bed.
yeah, so you need to run a lot, maybe in the morning. So I don't know how this works,
Okay.
but when you sweat by doing exercises, then somehow the TMJ pain comes down. And the last factor to this temporomandibular issue is stress.
Okay.
So if you're thinking about something, upset about heartbreaks, this, that, anything, some illness at home, I don't know. Stress exaggerates.
Right.
So these are the main aspects you have to work around this for someone of our age.
Okay.
I'll give you also this doctor's number. He's a Malayali only, but he's in Bangalore.
Okay.
So you can maybe just message him. He's sorted out a lot of my patients' severe
Ayurvedic
problems.
doctor?
Sorry, yeah,
Right.
that's right. So my expertise is nothing without surgery, and I don't think that's the best thing for her. And we should reserve that if nothing else works.
Okay.
You try all of this for a year or two. By the time she's going to be 20 or plus, and then if she's still going to have something, then we can look at surgical options to sort this out. But at the moment, I think this will work. And most likely, she's going to be fine by that time.
Okay. Sounds
What do you
good.
think? Think it's a good plan? So what are the things you're going to do? Can you tell me now? Yeah. So when you say not opening too much, what are the things it means in your daily life? For example, you can't go and sing, right?
Yes.
You just scream, you can't scream. No yelling at parents or anything, no calling your dog out loud,
Yeah,
whatever.
what?
All these things you shouldn't, because it goes to second level. Real life, that's what it means, right? And then no having a lot of chewing gum or have something very hard, no opening the mouth wide to
Like it.
bite a bone or to have all kinds of things. Yeah, you have to avoid consciously. This is the most important step, right? Then what is the second thing? Yeah, not try. You should make that a habit to not sleep on the sides, because when you sleep on the side, it just, you press here and it moves there. This bone is just one curved bone. Sleeping on the back helps. Then, yeah, the Ayurvedic things I told you. So they have different formulations. Some of them say apply the oil, put the hot water, whatever they suggest, doesn't matter.
Right.
Basically, you should do this. So it increases the blood supply to the region. So you're giving the joint rest, you're increasing the blood supply, and you're letting nature do the trick. That's it. I don't recommend any medications also for this.
Okay.
Just do this much. Sorry?
Yeah, you just mentioned the oil. What kind of oil you had to do it?
So,
Just massage some oil.
so I'll give you this doctor's number. You ask him for that.
Yeah. Oh, okay.
I do have some other thing that other doctors here prescribe. If you want, I can let you know where to go and get it. but it's better to probably contact him on that part. But the logic is that, or you can meet any Kotakal Ayurvedic people and tell them that you met a specialist and they suggested you should get some oil for the knee. They'll give you. There are many things it works. These are the main things, and I told you some more to the next point. I told you something else after this.
Exercise?
Yeah.
Jogging?
Yeah, that's good. Talking, I think, really helps. I don't know how it works. It works. And the last thing, stress.
Oh, try to
Sorry?
stay away from the rest of
Yeah, exaggerated. Yes, there are people who had joint problems because of wisdom tooth removal. It can happen, absolutely. So when you do that, the small fibers and the capsule can get damaged. So you give it some time for it to heal quickly. So when was the wisdom tooth removed?
A year ago,
Okay, and did you have this pain any time before that at all?
a few months ago.
Okay, did you have
Because of the
severe pain before that?
one of the doctor we went to see it,
Uh-huh.
he mentioned to get better, take it out 4 wisdom teeth out. Then it's not frequently walking out now.
Okay.